Calling to order the December 18th, 2025 Board of Health meeting. Welcome, everybody. Happy Hanukkah, you guys. Thank you for coming. Sure. We appreciate it. We have, before we get to this, does anybody want to add anything to the agenda or change the place of anything?
Request that we add a discussion of the ad meliora agreement.
Do we need a second? Second. Okay, thanks. All in favor?
Aye.
Okay, I'd like to add that under old business, please, because we discussed it previously. Anybody else?
I would like a line item just to discuss the sunsetting of the SSP program in June, and then discussing the HCV, hepatitis C rates and HIV rates in our packet, just to have a discussion today.
Wonder where that should be.
Well,
We don't need to vote on it, right? You
No.
just want to discuss it.
Just
So,
either before or after, maybe, Nick.
okay. Let's put it at the beginning of new business. Does that sound
Yeah.
okay to everybody? Do I have a second?
Second.
All in favor?
Aye.
Lisa, I'm probably going to look to you to lead that. Sure. When we get there. Approval of previous meeting minutes?
I moved we approve them as written.
Second. All in favor?
Aye.
Any opposed? Okay. Before we get to general public comment, department updates, I want to welcome Dr. Pritchard back. Yay. It's been a long time.
It was.
Would you like to say anything about how happy you are to be back? Anything at all?
It's good to be anywhere, actually, to paraphrase someone else's thing, but yeah, it was kind of a scary thing that happened. I fell off my roof, in case somebody doesn't know here, and sustained several fractures, and I'm walked in on my own power today, so that's I'm about 85% recovered, so I'm doing rehab and physical therapy rehab and occupational therapy for my shoulder. They concentrate on arms and hands. So it's been I wouldn't recommend anyone get on a ladder over 60, who's over 65. Would you agree with that, doctor?
I was saying, when I was a resident, one of the residency directors, one of his questions when someone turned 65 was, "I need you to bring all your ladders with you to the appointment because you're no longer allowed to use them."
Yeah.
So yeah.
I wish he had been there.
Yeah.
To mentor me.
We're glad you're improved.
100%.
We're glad you're here.
We're so
Yeah, thank you.
you're doing so well. I am also seeing there should be another amendment to the agenda under new business. Lori needs to add staffing agency for permanent nurse placement.
I'm sorry, what was that under?
It'll go under new business.
New business, okay.
It is something we need to vote on, but I'm sure Lori can explain that to us when we get there. I guess I'll make that motion. Any second?
A second.
All in favor?
Aye.
Any opposed? This is, again, before we actually get going, this is an important meeting. It's our last meeting of the year, so you'll see at the end of the agenda where we need to talk about dates for next year and what we're going to do with officers, but it is Lee's last meeting, so I would like to formally thank him for his service. It is also my last meeting, and I would like to say how much I've enjoyed working with all of you, but really, the important guy in the room here is George. This is George's last meeting. I was on the board with him in 2000 and 2001, and at that time we were going through PCB cleanup at the old Westinghouse plant, and I was just always struck by how knowledgeable he was, and he's just like George's knowledge on things is we need to like get his brain and just like keep his brain here in a jar if we can. But I think I speak for all of us when I say we are really going to miss him. And I'm so grateful for your years of service. I'm going to ask Stephen Kay to say something too in a minute. And then we have Commissioner Madera here as well. But none of us can think of the year that you started on the board. Do you know?
I was president from 1997 to 2005, so it had to be before that.
Okay.
But I know.
You were a known entity.
I don't remember that.
Okay, so George doesn't know. We have no idea.
The only reason I know that is they gave me a plaque.
That's good. You
Wait,
deserve many plaques. Many plaques. All we have for you is a certificate, but
Oh,
we hope that
Excellent.
you will accept that from us. And we do have a card that got a little wet on it.
well, so did we all.
So, Steve and Kay, would you like to say something for George's momentous last meeting here?
Well, the thing that really strikes me with George is his vast array of knowledge. You can talk to him about a tree that's infested with bugs. You can talk to him about water, our water supply and how things are. He just talk to him about something they've just discovered in the organism, and he'll tell you everything, and it's relative, and the knowledge is so that he must just read journals constantly. I'm guessing, but I think that's one of his favorite things to do. And really, I'm going to miss George personally as well as professionally. Personally, because he's my buddy. We walk up to the parking garage together, and he's my backup if I don't have a quarter for the parking garage. But also, we have conversations on the way up, and we've gotten to know each other better, I think. And I consider him a real friend, and I'm going to miss it.
Yes, I think we're all. I'm going to miss him incredibly, Steve.
Yeah, I agree with everything that's said, George. I was always surprised about when we were talking about it, had a subject we were talking about how much we depended on you to provide the backup information. Or you would say, well, I remember when we did this and this, and I was like, okay, I don't remember that, and I was on the board then. I think I may be the next longest serving board, and I don't remember when it was.
Probably right.
Yeah, I don't think I don't remember when it was that I started, but I am going to miss you, and as everyone has said that they will. So I wish you well in your future endeavors, which won't be this, but hope you keep an interest in it. We can use you as a resource.
I'll try to provide institutional memory as required.
Yeah. Okay. Fair enough.
We took you out of it, George.
Well, at 87 years of age,
Yeah.
nearing my expiration date, and maybe you'll soon have my brain in that cut. So,
Lord,
But can we access it?
so
But I don't know if we can access it in that chart.
no, that's a problem.
Yeah.
That's a problem. Yeah.
Would anybody else like to say anything before I ask Commissioner Madera to Sarah?
So, George, what I will miss is not only your depth of knowledge and breadth of knowledge, but the way that you weigh in on things and the information you give us from outside for the Friends of Lake Monroe, for instance. And so I'm hoping that not only will you continue to give us institutional knowledge, but that you will weigh in as a citizen on behalf of the health department, because clearly we need good informational people backing up the measures that the health board needs to have help directing in the public. And you won't have to do it in that big room where you can't hear anything. You
Yeah.
can do it from home where we can all use you.
Well, thank you, Sarah. Those are kind words, and I appreciate them. And so from everyone, the lovely certificate and the card, which I have not yet read, but I'm looking forward to it. And it's been a long and winding road and very interesting. PCBs, smoking ordinances, COVID, of course. Yeah. In the early days, we were actually doing the, I guess you could call it zoning for the county because the percolation fields were too required for every home. So we had crowds of people coming asking for variances to the ordinance for the septic fields because they couldn't build a granny house or a second house or a garage or, it was quite a while when we were involved with that as well as all the other things, including the PCB smoking and COVID. So it's been fun. But the best part has been the people. We've had a merry little band here over the years. It's changed. It's been full of very knowledgeable, very conscientious people. And it's been great to see the kind of civic engagement that occurs in groups like this. This is where the rubber hits the road, folks. And it's been fun being part of the rubber.
So you were appointed by the commissioners, and I believe the commissioners would like to recognize you as well.
Yes, so I have an encomium to honor George and his longstanding service to Monroe County government. Could I read it?
Absolutely, please do.
Whereas after his retirement from the biology department at Indiana University in 2002, George pursued several important community projects, including his work with the League of Women Voters and the Friends of Lake Monroe. And whereas for more than 2 decades, George has shared his insight with his colleagues on the Monroe County Board of Health, George has been a constant presence at board meetings, sharing his extensive knowledge, wisdom, and experience with board members, health department staff, and the community at large. Curiosity and accuracy have been guiding principles in his service on the Board of Health. And whereas while we appreciate volunteers who are members of Monroe County boards and commissions, we are especially grateful for those who dedicate decades of their time to serving the community. And whereas we acknowledge with our deepest gratitude and respect the contributions of George to the well-being of Monroe County residents. Now, therefore, be it resolved, we, the Board of Commissioners for Monroe County, Indiana, do hereby express our respect and gratitude to Dr. George Hageman and his outstanding contributions to the Monroe County community. Like, woo! And I have to note that we do use our formal title in the encomium, not the proclamation.
It's beautiful.
But I just wanted to personalize it a bit more.
Thank you very much. And
Thank you.
it's not wet.
It is not wet.
Okay. You did much better than we did. Thank you. Thank you very much for coming. We really
Thank you.
appreciate it.
And thank you.
Oh, that's beautiful.
That's very elegant.
Okay, so now to the hard work. We're gonna open it up for public comment of anything that is not on the agenda. And do we have any? I don't think we have anybody in the room.
We don't have any room.
Don't have any hands raised. If you're online, you want to make a comment, please raise your hand. Otherwise, you will have another opportunity before we vote on things. Thank you. I'm going to turn it over to Amy. This is sad too. Lindsay Shipley from IU Health Public Health Clinic for our last report. Holy cow.
Yeah, so I think you have our report in front of you.
Yeah.
So I'm just, I think we've, including our immunization clinics, at the schools and then outreach, we've hit almost 100 outreaches within the community for the year. But so I just highlighted a couple of those in the report. And the one from December 6th was one of our biggest outreaches of the year. Did a ton of blood draws for that community, and they are so gracious, and we're honored that we get to serve there with them. Immunization, so we've had adequate supply. There's this time of year, there's always a shutdown as far as being able to order and receiving shipments because they're renewing all the profiles and things like that. So in that time frame where we can't order anything, currently we're going to be transferring backscare and VFC profiles and things like that. So we're in that process. But we did this fall go to 27 schools within the county. That's private and public schools, and gave a total of 641 flu doses administered there. As far as lead updates, we have less than 5 confirmed cases that we're managing. Currently, communicable disease, knock on wood, there's nothing, no outbreaks currently. TB updates, there are none that are active at this time, but nurses are managing between 20 and 25 cases for LTBI. So we'll continue on that. So earlier in the year, we developed a patient satisfaction survey kind of on our own accord. And it's anonymous, and, you know, people choose to do it or not do it at the end of their appointment within the clinic. So I love looking at that data, but 97% of patients said they're likely to recommend our clinic to a family member or friend. I also like to look at who's new to our clinic. So 45% of those surveyed in the office were new patients to us. So that's really good. And then 100% of patients agreed that our nursing staff was professional, knowledgeable, and able to answer all of our questions with the visit. We take a lot of pride in that. Recently, just like a week or two ago, this was an anonymous quote from a parent that said it was the best experience with shots that my kids have ever had. And I just thought that was so great. Other updates. So our goal for the year was at least 500 blood pressure screenings within the community and 3,000 vaccinations. And we have surpassed that goal. I'll send all of the end of the year data once I have all of that. So probably the first week or two of January, I will send that over on our spreadsheet. We have connected with staff here at the health department to train on tuberculosis, communicable disease management, and lead management. So we've spent some time doing that. And so we're just trying to help for a really smooth transition with all of that. I know, you guys are looking to hire, and so we just want to help in the transition as much as we can. Reminder, our clinic will still be open the 22nd, the 23rd, the 29th, and 30th. So all of our services will continue during that time. So if you guys need anything, please reach out.
Thank you. We appreciate your help during the transition.
Sure.
Too.
Yeah.
And before we get to questions, I just want to make sure to say, on behalf of the board, thank you so much for, again, your many decades of being our partner in this. We couldn't have done this without you. And I know we've had our bumps and our ups and downs, but throughout you have just always been there, done your best. You know, it's been incredibly helpful, and we really, really appreciate it.
I have some data you asked me to share.
Yes, I was just going to say,
Yeah.
and this is exciting.
So last meeting, you had asked about the extra staffing for HealthNet. So in community health at the beginning of last year, we started pulling our ED data, emergency department data, and looking at what in community health we had the ability to impact. And so there was definitely a trend of increased admissions in those evening hours. Wheeler was one of the places that was kind of an easy one to pull out. There's also increased admissions period at that point. So we started pulling data and asked Lori, met with HealthNet, asked if you all would help fund a position. So we pull this every month. We take the top multi-visit patients that are unhoused that are from Wheeler, and through an ED process, we refer those over to HealthNet. Also been working with local integrated health to help us with some of those in our house to see what kinds of things we can kind of head off, because a lot of it was, social isolation kind of stuff and things that could be addressed other ways. And so those numbers in front of you are what we pulled. You can't really go month by month. You have to go year by year because there's a lot of seasonality to the emergency department. So you can look at 2024 and 2025 and consistently, significantly lower each month. The health net's been in.
So guys, this answers the question that I asked at our last meeting when poor Amy was driving and didn't have, anything right at her fingertips. But it answers the question that we've asked ourselves for quite a while, which is we'd like to see the data for the number of unhoused people who were using the emergency department before and after we gave the money to HealthNet to start the evening, the 5 to 9 p.m. service at Wheeler. And so you can really see from this that there's been a pretty dramatic drop off in ED visits. So this is fantastic. And would you, in your email to Lori, you also talked about some other things that you guys had done outside of our funding for this that I thought were really interesting. Could you tell the board about that?
Yeah, we just tried to look at why people were coming. And so one was very quick, tangible thing because there were several 911 calls because they thought maybe the blood sugar was high. We bought some glucometers, brought them over to the shelter. People use them. So there's checking the blood sugar.
So it's such an easy fix, right?
Yeah. So looking at that, having a data person on our team has been a game changer because now we can drill down to the why behind a lot of things. It's just one of those. So some thank yous that I want to say, like one is thank you for funding this. And I, would be a big champion of funding it going forward just because it's been really great for the community. They do like great work. Also just want to say thank you to Kathy and Linnea have been coming over and learning from all the staff, and they've been super easy to work with, and they're digging into all of it. And so doing a great job. And then Dr. Hickman, I've been coming to these meetings off and on for 15 years. And so you've always been a kind and friendly face, and everything she read was like so true. You're always very like inquisitive and ask questions, but also know a lot about a lot of things. So thank you for your ownership.
Thank you. Any questions?
Is there ever a problem in this month? Like, are they losing some evidence at the end of this? I don't know what's going on.
Yeah, they're not going to be doing the work under the contract for us. The health department is going to be doing the work.
We in our community health, I mean, they're now looking at the health department and health that is like a March thing, But I was thinking that having you guys here has been a game changer for us. You always just refer here because I know when I grew up, public health was everywhere. Because I got to sit up well and everything. But you see a change in people when they're not wanting to go to health vet. You know what I mean? Like there are two reports now. I mean, left where you come here too. It's really big thing. It's a trend, And so thanks for guys.
Thank you. If there's no more questions, I can let you guys go. Oh, Sarah, go ahead.
It's just a comment of how important the 6 decades of connection we've had with the nursing staff has been, how much delight I've had in the last year connecting with all the nurses. And how much I will miss you.
You can probably still go visit them.
I am. I know when you're in and when they do lunch.
Yeah. Thank you very much. And thank you for coming, and thank you for the great report. We really appreciate it. Okay, I'm going to turn it over to Lori.
I don't have a whole lot, but probably some important ones. So County Attorney Miss Molly Turner King from the legal department she's drafted an interlocal agreement with the Morgan County Health Department. We are still just waiting for information back from their auditor relating to payment. So payment for services and what that would look like. Then we can finish moving forward with that agreement. Since there's no more county business meetings for this year, Once the final draft is completed, we are looking at going to the commissioners and council then in January for that. So they're available to come down twice a month on Thursdays to be able to provide some vaccines so that we could offer vaccine clinic hours while we get up and running. An offer has been extended for one nurse position at this time. So the candidate is working on completing pre-employment paperwork and screening. With the holidays and the closures, I'm not sure if a start date would actually happen this year. The earliest one would be December 29th. Otherwise, the next start date is January 12th. But working with that candidate, and interviews have been scheduled for 2 applicants for next week. So we haven't received any additional new applicants coming in, but from the ones that we have received, we've been able to schedule interviews. The health services director position has been reposted. We haven't received any applications for this position at this time. We can talk about that a little bit more, I think, under the new business item. And let's see.
What is that position? Health service.
So the health services director will be overseeing like the clinical based services, so a manager for the department. As Amy mentioned, Kathy and Linnea have been completing communities training. I've completed the training as well, have access to NBS, been working with individuals from the Indiana Department of Health on those trainings. We do have someone from the Indiana Department of Health that's going to come down in January to provide some on-site training related to using that system and the case management. So feel pretty confident that we'll be able to, go into January, handling those cases well. The loss of the STD grant funding due to the hiring freeze went through to the commissioners today. So we did have to get actual signature on that reduction that occurred since we couldn't hire that additional position.
Is that the one where we lost the $100,000?
This was 58,000, but it'll end up being close to around $100,000 total from that grant. The grant was around 348,000, but around 100,000 we won't end up using related just to what we were provided for personnel costs and related expenses for personnel.
That's insanity. Sorry.
Let's see. So we are currently helping with coverage to Morgan and Shelby. So those were 2 of the 4 counties that the state was looking to us to be able to help provide coverage for. We just don't have the capacity without that additional employee to be able to provide the services in Hendricks and Johnson. So this grant will expire in February of 2026. And so not kind of sure how that may or may not change next year. Despite this grant funding loss and the short staffing, our disease intervention specialists would like us to begin offering walk-in testing on Thursdays. So they're looking at being able to offer this on Thursday afternoons, just because they're having some challenges with managing appointment times 3 to 4 days a week currently because of the limited space in the department. They're having to use a shared office space when they bring patients in for appointments. So essentially it means the other employees can't do their work because one employee is working one-on-one with one patient. So looking to eventually be able to have a room downstairs where can be dedicated for their testing and be able to offer just a dedicated afternoon for walk-in patients.
And this would be just a screening clinic because we don't have a condition and CTGC, syphilis and HIV.
Mm-hmm.
Yes, thank you.
Look, don't read through our contract in my building if you need it. Also, and I just checked into this in my morning. So if you guys need to use it, you want them to welcome, please let me know. Okay, Jeff Random, space by a building.
Thank you. Thank you, but I do need to to say you are a member of the public. And so this discussion is just for the board.
I'm sorry, thank you.
Thank you.
It's kind of embarrassing.
Let's see. So talking about including the harm reduction specialist in those testing clinic hours too. So then we could also help to distribute Narcan, provide education and related supplies as well. One person would be rotating to help greet patients, collect intake paperwork. Since the hours would be extended in the evening, we would be having to essentially reduce the employee hours elsewhere during that pay period just to avoid going into overtime. But that can be pretty easily worked out to provide that coverage.
Do you plan to advertise this?
Mhm.
So this is a big, we've never had STD clinic. Never. So it's very exciting, but I just.
Yeah. Do you think they might be overwhelmed? We'll really need that extra person.
Well, they might, once word gets out, you might be.
Free testing.
Don't you think?
It also.
My head doesn't swivel that far.
Yeah. Well,
We'll have to see what happens, I guess, but.
even if you look at just the charges that, so the costs compared to being able to come here and get the testing, for free. Yeah. So,
Okay.
yes, did you have, sorry, I thought you had a question.
I had a question just about how, is our Narcan supply been interrupted at all? Are we still getting?
We
No.
still have adequate supplies, right?
Yeah.
Good.
Okay. And then, so I spoke with the legal department recently related to, again, some of our funding challenges and ongoing employee training and certifications. So they advised that in 2026, the board should probably want to consider strategies to navigate costs related to employee certifications and licenses, since there's no set policy from the county on how this is kind of handled. So historically, it's kind of been, what funding is available, what's crucial for or required for a certain position and for the department. Of course, when we had that increase in Health First Indiana funding, that provided flexibility so that employees could have funding for conferences and additional events. But now with the cuts, we just don't have that same level of funding right now. So some things to think about for me. One challenge I think that I've had is it's really hard to try to develop a process or a policy when you don't know whether you're going to even be able to have guaranteed funding. So how do you create a structure if it says these positions have to have these required trainings, but you don't know whether, funding is going to be there? And should it be that the board reviews each individual job description to see what the job description has and the job requirements related to licenses and certifications to determine which positions they feel should really have the county paying to keep those licenses and certifications up? Or is it, if those are required as the job requirement to enter a position, is that the responsibility of the employee to maintain over time?
So to help the board in January, because obviously we're not going to solve this here tonight.
Right.
I'm wondering if somebody could put together a list of maybe just the employees that you have and the licenses and certifications that they have that either we require, or it's just like good for a health department to be professional and for people to have certifications and licenses, right? And so they have to have a certain number of CEUs to keep up those certifications and licenses. So I think if the board could see a list by maybe not the person's name, but the position.
Yeah.
Yeah.
You know, the job title, this person has to have this certification to do the job.
Mhm.
You guys would be in a better position to at least know what you were dealing with in terms of.
Yeah.
It'd also be nice to know what the cost are,
Mhm.
like next to the two.
Mhm.
So we know what kind of money are we speaking of.
Yes, absolutely. So working on getting that criteria picked out from each of the job descriptions, what have historical costs been or anticipated cost and or
Do you
anticipated.
know what other departments of the county do with that kind of certification? Because I know you have to have it for septic and.
I was gonna ask you that too. When you.
Fire department has to have certification.
So
I've
I've heard that it's really varied. That, like, for example, the probation office or some of these other offices might cover that. And they have that, but then other offices, it's just a responsibility. So again, it's kind of hard to, if there's no set kind of ground or policy or structure to.
Can you also include in that, how many, for any given certification, how many hours of CEUs they would need to maintain and how often, whether it's per diem or per annum, every 3 years, whatever, so that we have a pretty good idea of what it means, because clearly we know that virtual, and particularly free virtual, is going to be a lot less expensive to the county, i.e. to the department, than being on site. And while everybody would love to go to wherever for a meeting, that's just not going to be feasible with the way our finances are going and what we can anticipate in the near future. So that would be, I think, would also be useful for us to understand within that big framework.
And also, I think it's kind of looking at, so if you're required by law to, have an employee or contract a service out that's, then how many, do you want to have one employee, one position, two positions? How many kind of, or do you want to scale that up and down depending on funding? Or even maybe rotate the licenses and certifications to always make sure that you have that kind of ongoing coverage.
It would seem like for some of them, it would depend on the work and whether you have to have a certified person to do that. And you'd have to then have two, because what if that person is out for a period of time? Who would cover that? And can somebody be certified in two departments so that there can be cross coverage the same way we've been trying to do some cross coverage elsewhere in the department?
Yes.
You thought this was going to be a short report.
Well, that's really kind of.
Is that the end?
Yeah, brainstorm.
Although I want to go back to the beginning of your report about Morgan County, because I've said this before. I just want to say it one last time for whatever it's worth. I am much more concerned about our inability to do communicable disease investigation that we are required to do by law than I am by our ability to offer vaccines. IU Health is still there doing vaccines. I don't need Morgan County for that necessarily. But we need them if we have an outbreak of something horrible, so that, because we won't have the ability to do that. So when you gave your report, you mentioned they're going to come down on Thursdays to do vaccinations. And
that's really the capacity that they have. And so I think that's why we've been having people here that are here now doing that communicable disease training.
And it sounds like IU Health has done the lead and TV with them anyway, because I know those are really structured. Okay.
Kathy and Lene are learning and are ready to jump in to help track that stuff.
Okay.
That's my understanding from the nurses and from the two of them. So, while we may or may not have already have one nurse who, and the individual we reached out to first words were, when we asked, what do you want to be doing in the first 3 months? It's like, be fully trained. And I was like, hallelujah, somebody who doesn't have like lofty images, but wants to be fully trained. So, you know, as for any of our other health nurses, as I understand it from them, you know, a lot of it was just on the job, learning it as they went along. And now we've got 2 people who have backup, and even our boss can help with that. So, you know, I think, I don't know how much we would need help from an out of county
Okay, good.
health department. That's just, you know, my inside view.
Okay. I did give Lori a big list of free online trainings around communicable disease investigation. So there should be resources. All right, thank you. Any questions for Lori about the report?
Can she also celebrate that she has a new administrative assistant?
Oh,
Can you tell us about that?
yes, gosh, when did she start? I don't even know. It's been such a whirlwind. Small projects here and there, and that has been a huge relief. But of course, having Kathy Hertz has been a huge relief too, especially with these changes, being able to kind of offload some of the other tasks has been really, really helpful.
And what's her name?
Marissa.
Okay.
And can we also celebrate that most of our old grant funding stuff is off the table at this point, or at least really close to being off the table, so that we are looking pretty clean?
Yes, so the old grant funds, I think there's one lingering one that we're just waiting on some approval from anyone who will give it that we can find. Since this was, you know, 10 years plus ago.
Yeah.
So working on that, but the rest of them, yeah, that was a lot to get through, but I'm cleaned up.
Other things to celebrate, and I also.
Okay. Moving on to old business, we would like to turn it over now to Nick from the Indiana Recovery Alliance to give us a report on activities in the last year or so.
Thank you for clarifying that. Sometimes when I'm in a room, I just talk and I should hear what's that. I'm just really glad you said that.
That's fine, thank you.
Normally I have infographs in the beginning, an email, and probably delivered it soon. But we've been really just like pell-mell with the new administration stuff that's coming in and working on legislative stuff. So I want to tell you about my years. I came here from disability. I was 10 years on SSI. I left here because I couldn't sit down anymore. I couldn't be not working. And when I found this calling, I had to go. You know, I didn't have a choice. It was like my body moved itself. It's also hard on someone who's disabled. I had full blown liver disease. I have a pre-hepatic encephalopathy. So my body doesn't produce ammonia very well, right? And I also this year found out that my body doesn't expel CO2 very well. And I smoke, so it's really bad. Found myself in a hospital bed. During the whole time that I was having episodes about it, my wife didn't give me Narcan. It looked as if I was messed up. You know what I mean? Like people who came in thought that maybe I was doing something just horrible for me. You know, because I strive to be like a high functioning person back in. And don't remember it. I just remember waking up in the hospital and my wife was telling me, you know, hugging me and screaming and crying. And this has happened to me before I came here. You know, it's just when it pushes the two things equal out like this and I'm not taking care of myself, it just cascades out. I was working really hard. We lost our staff. I was just scared. You know, I just ran hard. And she said, God, I'm glad you're awake. It was everything I could do not to give the Narcan. They wouldn't listen to me. And I thought, well, did you tell them I didn't need it? And they're like, yeah, I told them over and over you didn't need it. And the idea that my wife had to put me in her car, they would put me in the hospital. I'm out, right? They're putting oxygen to keep me alive. They wouldn't take me in the bed unless they Narcan me. So my wife drives me there, gets me out, I get in there. And this really sweet nurse, I guess, was like, no, we know this is, hey, we see his medical stuff. So I wake up with her and they tell me everything. And as I got a little bit better, I woke up and they let me go and gave me the refractin and lactulose, 2 medicines for this thing. And as I got home and started working again, 5 or 6 people came over to my building to make sure I was okay. You know what I mean? And they'd sit with me for hours, making to see if he's gonna drop or what's going on. And so I sit with him for hours, just ask, figure that's what it was, And I never in my life thought that that would. I had too much privilege. I didn't realize it could happen to me. I've advocated for people who are being treated horribly because people think they're using drugs, but I had never advocated for myself in this particular way. And it was an eye opener. It was an eye opener that there were good nurses out there and good doctors. And it was an eye opener that I am still subjected to the sins of my past. I mean, no matter what I ever do, there are still people who will never forgive that, And it was also amazing that my staff and my wife were just lockstep, So I didn't suffer because these people had been trained by me or by someone else to advocate for me, And we teach the nurses a lot. And I explained the story to them. I was like, what stuck out for me was the trainings we give, the stuff this IRA has done, has filtered into our community so much to a way that even lay people would understand when we're talking and going through this. When you're suffering an overdose, you can't speak. You know what I mean? You can't even breathe. So I was talking and speaking, and it's just the whole idea of having to go through that changed my mind. I will forever love Mark from Amethyst, who came over and he has a gate in his hip. And I asked him if I could say this, by the way. He has a gate in his hip. And I asked him, I said, do people ever think you're drunk? He goes, I've dealt with that for 10 years, man. Just don't worry about it. And the fact that it happened to him, I talked to other people with disabilities and that happened to them, made me understand a broader piece of all that we're doing. It made me understand I'm getting old. Still when people try to grab stuff for me, I get really mad. I'm really angry. I know some of you have been through this. People try to help me, I get mad as a pistol. All of this, I'm saying that this is my personal thing that bled into this next year of we have to step up stuff. Better self-care, better stuff, better things going on. As we did this, we've been planning to do this multifaceted thing at our place and build the second part of our building, which we hadn't gotten the money for yet. And at that turning point, I think something just kind of clicked in me and I went mad crazy, good, real proactive. We did a whole redo of our stuff, which all said you guys would have said it's a re-implementation plan. All of our job duties, all our stuff. We are now an RCO, which is Recovery Community Organization. Even while I was sick, we got the CDC's Center of Excellence. Only 7 people in the entire country got this. I then got it for another year. 2 times the CDC has recognized us. This isn't just me. This is Kathy. This is Lori. This is you guys. This isn't something we did as a community. Not only that, but we're also flat funded. All of the stuff that came down that messed up funding for everybody, NASDAQ, the people that we get funding from, was flat funded. They didn't even have to go through the rigmaroles because the work they were doing was so huge. Indiana's the only place that led 22% of overdoses, which I think the statistics are skewed because I think just statistics are weird. But so I think it's a little bit more. We are the only people who saturated our state in the way that we did. This was done as a community from Bloomington. At that point, Damien didn't really exist, and some of these other places didn't exist. So we pushed that out. We sent naloxone to every single part of the country, of the state, and we still do. This year we opened up, took over Ship Happens, which is a person-to-person naloxone distribution center. So that means people can get big stuff from overdose lifeline, but what if you're just 2 people and you just want a couple doses of Narcan? What if you're telling your son that I don't want you to go out. I don't want to stigmatize you and have you go grab it from a box for whatever reason. And here's this, and here's how you use it, We implemented these sharps boxes for people. We started to think about how people could see this in a negative light and how we can flip it and how we can be better parts of our community, So we send these out now, which I think some of you might have seen these before, but they entail gloves, tongs, the sticker, which messed up because my wife didn't get our old address up there. And then
Nick, you have 4 more minutes for the presentation.
okay, I'm sorry.
And then we're going to allow 5 minutes for questions.
I didn't know, I'm sorry. Anyways, this year I'll pass this around. We have surpassed all of our stuff. We have actually drastically decreased syringe output and increased input. So we are now giving, you'll see in the final report that we're giving less syringes out. We mandated something that Kathy started, which says, what do you need till you can get it the next time you're in here? And that changed the game a lot. So we're actually giving out less syringes than we ever are. We had people refer to treatment more, and we've seen 11,000 reverse overdoses reported us since we've been here, and 10,000 since I've been here. So
So is there a written report?
it will be, yeah.
I don't have.
It's not, you won't have it because I just started it.
Okay,
You'll have it probably,
okay. I'll stop looking for it.
yeah, tomorrow. Normally sometimes I have these right in, sometimes I have them before. Today my wife, as I was finishing doing it, my wife's mother broke her arm. And so I had to try to attend to that and get here. So
Thank you. Questions
please.
for Nick?
I'm very concerned about the syringe program, right now, the continuing, yes, statewide. Nick, do you have any feedback on it or?
I do actually have wonderful feedback. I was too. And there's a group that's been working on this. I chose to work on it a little bit differently. And there's a Senate bill right now Senate Bill 116 to take away the felony for syringes altogether. There is Senate Bill 91, which is the one you guys might know about, that is to extend the sunset clause for 10 years. Until I'm sorry, I want to take hours to tell you guys this stuff, and I just need to write it up and give it to you. But the other day, standing in front of the Monroe County Commissioners, I think it's the best feeling I've ever had. It's like unanimously, like, we need you, we want this to be forever. I think we have a way to keep it here. I mean, I'm worried, but I'm not too worried. There are lots of people working on it. And we've seen Republicans make these bills. These aren't Democrats. These are Republicans that are making these bills. So I'm worried, but even if they took syringes away, it really should be in public health. I wish that I could have it be only doctors and nurses and or something like that. We only do this because we're pushed to that point, But no, I'm not 100% worried. I'm actually better now than I was. And these bills may go in, may go out. We'll still be here. You know what I mean? And I'm pretty sure that nobody wants to change what made the only state in the union save lives. You know what I mean? Like, it's a huge thing. Also, just the money part. We save more money with an SSP than anything else.
And that's going to be important to point out, I think, to the legislator when they go to vote.
Yeah.
For sure. So
The economic advantage of having a program speaks to the practicality of the issues.
Future. What is your current resources to refer patients for PrEP? Because we have, I'm going to address, we have an HIV, we've impacted hepatitis C. I think we have that data, but now we have a rise in HIV in Monroe County. And so what current programs or what do you all have in place, or maybe there isn't anything where you can refer clients for PrEP who are IV drug users?
So we work really closely with Positive Link. And as you know, Meredith has taken it on. The ship happens had 1,000 home tests requested in 1 month. We are pushing with a group called Nexus, and I can share all this whenever you want. That is going to help us do some testing and excellent focus. We also are trying to do something with Gilead, so we can get as much money as we can in for testing, and work with Kathy to get more testing. I'm sorry to say, but incentives are everything. If you give somebody $10 coming to get tested, people that don't want to get tested will come in. So we're going to increase those and make a point of, by 2027 at least, that we have hopefully almost covered our county. And I laughed when you guys talked about the other counties, because Owen and another one is something that I have to do as an RCO, and I was hoping there's overlap there where we can get there too. But we are concentrated on it. What had been the problem for us was that we can't have that clinical stuff at RSP. It has to be referred. And so now Meredith comes in every Tuesday night. So there's a direct line to the person, and then we can refer them. But if they wanted to, they could go in and talk to Meredith, who's probably the single best person I've ever heard talk to about HIV. And we're also really concerned with that. We're concerned about the outbreaks in Maine. We're concerned about the outbreaks in Georgia and here. I mean, this is literally all I look at every day. So yeah, I agree with you. I'm very scared. That's one of the reasons I was scared originally about your question. Is it's like, what do we do if you take SSPs away from the place that stopped an largest drug user outbreak in history? How do you tell your constituents that's okay? So thank you.
And when clients come, are we gathering data on, and it's difficult because of the unhoused population, but are we gathering data on how many people are from different communities out of the county, even out of the state, who are here, coming here to participate in the programs that you have available.
We can't legally let anybody take surrenders to other counties. So when people come in, they say, this is for Monroe County only. Now, I can only say to them, you have to use these in Monroe County. They can do whatever they want. But I know people, I'm pretty good at it. As far as the other services, anyone can come for those services. The IRA does those services. Like, we have stuff we do with the health department alone, and we try to do every single piece of that as we can, because that's where our strength is me and Kathy and Lori and all of us together. But if someone came from Alabama, we don't care. We'll test them. We'll give them referrals. We'll give them treatment. It does not matter. I don't care who you are. If you come into my building and you need help, we're going to help you to the best of our ability. I don't care where you're from. You know what I mean? That's kind of our goal, you know? And we do collect data. SSP data is so hard to deal with sometimes. What I can give, what I should give, whatever. If you ask me, I can just give you a printout of what data we collect. And if you guys wanted something else, if you said, hey, Nick, I really want you to start collecting this, we could do that. As long as it's not invasive to my people, as long as it doesn't stigmatize them as they came in. I'll slow down talking about this, but someone came in to do a survey. And they went to survey homeless people out of our place. That means every survey they do is in a SSP, and homeless people are coming here. So it's going to skew the data to think that everybody's a drug user that comes in as a homeless person. You see what I'm saying? It's very, very scary things, especially since this person is at IU. And so I had to stop them and get somebody national on the call, be like, no, you're wrong. I'm like, oh, the person's like, I know what I'm doing. So I had to have this person come on there and then call their boss, and if you don't know what you're doing, that needs to stop right now, get out of there. And so, you just have to keep watching all these things like that. So if you wanted data, say on PrEP, how many people access PrEP? It would be anonymous, but we could do it. So if you just ask me, or ask Lloyd, ask me, or ask Kathy, and I'll put it on the thing. Our data is at anything in and out. So it's Airtable. If you want to look up our what we use on the program called Airtable.
Thank you.
So I remember last year you told us that once you moved, you were going to have an open house that you were going to invite us to. So I thought I would ask about that.
Thank you. As you know, getting a building and fixing it is a lot more than I really thought. Somebody should have slapped me very hard. We are getting ready to, as Kathy is going to help me with this, probably like the beginning of this year. It'll be in very soon. Yes. In fact, I was wondering if you guys wanted to do a soft with just us. I mean, we have a lot. You guys have a lot in this game. If you want to just come with me to see it anytime, you're more than welcome to. We would love you guys to drop in and out. I don't care. You have to tell us, come in another, drop in if you want. Or I can set a special day before it, like an hour before, where you guys can come in and see what you've created. Like, I mean, you really should experience this stuff. It's unreal,
So maybe the board at your January, February meeting, like, you could do the first part of the meeting, maybe there to go tour and then do the business meeting. It's up to you. We won't be here. Several of us won't be here, but it's up to you. So that would be a way to do it.
I have one other question, and that is, I think you talked to us about an expansion of the mental health program. Can you tell us any more about how that has worked out?
So we have done this talk. We have experience with NASDAQ, and we've been strengthening SSPs. And we tried to get another group. Someone they weren't good actors, and I couldn't get involved with them. And a church asked me, and we couldn't do that. So what we started to do is that people come in, and when we're asking our referral questions, we change our questionnaire the way we ask. So we used to be like, have you needing a referral to mental health services? Well, of course, I'd be like, no. And so now it says, how are you feeling, or what's going on with you today? And there's a note section on the bottom. We know everybody. Do you know what I mean? Like, I've been here my whole life. It's like, it's rare that I don't know who somebody is. So if I see somebody and they're a little bit different, we go out and talk. You know what I mean? So we make it different. Like, that's kind of where the sweet sauce is with us. It's like we spend our time talking to everybody because that's our job. We have to know what's going on in the community. That's horribly heartbreaking. We had someone break just recently who was used to be completely now and has the brain of a 5-year-old. And it's just heartbreaking. So we have to be places to inform too. We send people to mental health services. We used to not send to Centerstone. We now do. Ashley has painfully made me aware that there are wonderful places inside some of these structures, even if I don't like the structures themselves. So, and a lot of it was HealthNet. Like we depend on HealthNet for a lot of stuff. And we just depend on our community. We try to rotate stuff. So we used to have these community outreach meetings that I'm getting ready to revamp next year. So we're all on the same page. I recently met Mark Fabris from the DORs, and I was blown away. He's just one of those I don't even know why he's a cop. Like, I don't even know how to explain it. Like, he really like didn't hit any of my radars. And we talked about this exact thing. You know, we're like, what can we do in the moment for some? They don't want to go to stride because it feels uncomfortable. What if they go to my building and someone can help with it? It's like a couch area in there. It's relaxed. What if that was the thing that made them feel okay? And then from there they go to service. So we're working, ever changing, trying to figure it out. But as you know, I mean, that's a despair horrible. All this stuff with mental health and everything is just exacerbated, you know, by every other thing around us, you know. Watching someone on a supply that you know will kill them is gut wrenching. And, you know, and then people try to take them away and get them better, and it doesn't work. You know, they have mental issues. It's like Ryan, who's been with us for years. He just got locked up, and he's probably ruined by now. You know, it's just, see, we're trying, but you guys know the gun wonder.
It's a problem bigger than you. Yeah, it's a problem.
Wait, I just want to pass these over again. This is what we put in the flyers, and we did it. You'll laugh in a minute, but you'll see why. And I'll leave these here. People were saying they didn't want to touch syringes. I will say syringe pickup is down so much, the police call us. Kathy and I work together with all the Lauren. We all do it logistically. There'll be a point when we're going to talk about some other stuff, but we're going to make Kathy and Lauren need to see if it's worth doing or not. But so people, when they're saying I don't want to touch them, they now have gloves and this. You don't have to touch anything, and you call me, and we're there. If Kathy says to go get somewhere, my buddy's moving quick, fast, in a hurry.
That's cool.
Yeah, hell yeah. And so that's
Oh, that is awesome. Thank you.
Thank you, Nick.
Thank you very, very, very much.
Thank you.
thank you.
We appreciate it. Happy holidays. Good work.
Is
Keep
there
it up.
anything I can do that you guys need done? Is there anything, what are people complaining about? Please tell Lauren and Kathy. Like, if I can get ahead of it, then we can get it. We all work together. You guys, I've known you guys now a while. Like, please say, hey, Nick, we're starting to get some stuff. What about this? And I really want you, I'll be proactive about it, you know? Or Kathy will get me.
Thank you very much. We appreciate. I hope it's not raining as bad when you leave. It's when you.
My life is rain, snow, and hot sun. I'm
Okay.
impressed. Thank you very much.
Thank you.
And I'm sorry you're leaving. You want to be a medical director?
We'll miss the program.
No,
Wow.
that's no. That was no.
Okay. Next up, Lee, would you like to talk about?
Yeah, just briefly. So Dr. Pritchard and I worked on developing a fund at the Community Health Foundation. The purpose of it was to fund those things that don't get covered, like you were talking about before, things that aren't in the line item budget. It's not a huge fund yet, but actually George has contributed and Dr. Pritchard and I have. So we recommended that you vote down this request from the Board of Commissioners last time, because they wanted to make this they wanted us to sign a pass-through document that allowed them to list this money in their budget. And we were being paranoid that it would probably be taken and well and used for something else. So after lots of legal input
by the council.
Yeah. So after getting some legal input, I went to see Jim Whitlatch, my own attorney, and we went to see the attorney at the foundation. Said that giving it directly to the individuals is super illegal, and so you have to have a pass-through document. So now I'm going to recommend that you vote yes instead of no for the same motion.
Would you like to make a motion?
I move that we approve the agreement between the Community Foundation of Bloomington and Monroe County for an established fund, and that that the board signs the pass-through document that's required.
I'll second that. Questions, anybody? Discussion? Is there any comment from anybody virtually on this one item?
How would one donate to this fund?
Very easy. Just call me. No, I was saying, no, if you just give this name to the people at the Community Foundation, they will put it in the correct fund. And there's a list in there, if you want to look at it, with suggested uses for the fund. But it gives a lot of leeway to Lori, or whoever the administrator is at the time, to decide if it's worthy. And then will be dispensed directly to the health department. Again, it's not got enough money in it yet to be considered endowed, but eventually we hope it will be. So it'll generate steady income for them. Boy, they won't be switched every time there's a change in the government.
All in favor?
Aye.
Any opposed? Okay, motion passes.
Thank you.
So do we need to sign, like, do I get some document to e-sign?
I don't know. I have to check on that.
Okay,
Yeah.
okay. We'll wait to hear about that. New business. Think, Lori?
I was
Me,
gonna
you?
talk about
Oh, Lisa.
hepatitis C.
That's why it says Lisa there. I was going, what is that?
So just some issues, and some of the data is in the packets. So just looking at the data that we have, from January to September of 2023, the number of syringes supplied for Marion County was 558,000. And then for that same period of time, the number of syringes supplied to Monroe County was 643,000. And it would be interesting to figure out why we have so many more syringes in our community. And I only say that because now I feel like we have an additional issue, which is we have all of these syringes that are, I know I brought this up last time, but that are in our community, because all of those are not being, the percentage that are being turned in is not super high. And some other data, this actually is data that comes from the state. So for Monroe County, from the years 2020 until currently the 3 quarters in 2025, of the 11 million syringes that were distributed, 11 million syringes were distributed between, I think it was 2015 and 2023, but just for us, for a 5-year period, we distributed 5 million syringes in Monroe County.
But didn't we have a 73% rate of return? If I remember reading it right.
Yes.
Yeah, so
And the state average was 80, but we had a 73%. Yeah.
Is that harm reduction report?
It seems like a lot of needles for a county compared to the whole
it's
state.
just a lot for number of registered persons, which, each year, so for an example, so in 2020, the active users for this program was 952. In 2021, 2,240 users. So 2023 was 1,700. So this is a lot of needles being distributed to each active user. So I don't know if we're getting good data. I don't know. Or are we really distributing that many needles to each user each month? I don't really, I'm trying to understand the data.
Did that raw data come from our department to?
That came from Monroe County.
State compiled report, but we have a county report.
You sent it to me.
No, yeah,
Raw data.
I'm referencing the data from Indiana State Department of Health, which you can request. And these are the numbers that came from Monroe County.
I didn't take it that we had that many more users. I thought, and maybe I'm wrong, I thought when they give out the syringes, they give out multiples to a person.
Sure.
So the number of people that.
But what I'm saying is, yes, that is correct. So, but we have 1,000 to 2,000 registered users per year, and we are distributing close to 1 million syringes per year. So I think there's no doubt that we have decreased. We see the data. Hepatitis C has decreased, but what we see in the data is now we have an upswing of HIV. So now we have.
How much is that? I had a question about that too.
Yeah, sure.
How much of the HIV increase is due to sexual contact versus needle contact?
It's
because
the
Right, we don't-
report is
With
not,
what we have on the data, we don't know that,
Yeah,
but
because then
it's
we
a
could,
question.
decide how to attack the problem. If we knew whether it was that we would do more prep with his organization, if it was needles, then we would look at the needles, but
Lisa, I'm not sure what you're asking for. Are you asking for greater clarification on the data in this report? Or are you asking that Monroe County receive fewer syringes because it seems like too many? Like, I'm not sure where we're
Well,
going with this.
my concern is that, well, if, first of all, if we have the sunset of this in June of 2026, so now what we're gonna have is all of these people who are relying on this program and they are just not gonna, I mean, I don't know what's gonna happen, but then they're not gonna have access to syringes. And I want to understand, I guess, why the excessive number. And I'm not, as long as it's making an impact in a positive way, great. I think, so I guess what I'm saying is we need more data. We need more data to figure out the HIV situation. Is that, is that from incarcerated individuals? Is that from HIV, or I'm sorry, from drug users? Is that from, sexual contact? So how do we get that data?
I have, because I used to work in this office, so I have a couple of thoughts.
Awesome.
I think somebody, Lori or you, could call Erica and ask her questions about this. So, because
Okay.
Erica's very approachable, she'll answer anything she knows and she'll refer you to anybody if she doesn't know it. And if they are still doing this, I don't know, but the state used to, on its website, post the HIV risk data for, they would post like sex and age group and risk factor for the HIV cases. So that should be publicly
And that's
available.
For
for the
county.
state, but you could ask for it for county.
Okay.
And I would say when you talk to Erica, because she works with the guy that makes the data for the HIV, you could just ask her that. You or Lori could ask her that question too.
Mhm.
Can you tell us for 2025 or whatever year you want, what the risks were in Monroe County? And they have that, and they'll probably be happy to run your report.
So the other piece of this is, as we move forward as a board in 2026, then we need to, if we are going to have funds go to Indiana Recovery Alliance, we need to figure out if we need, as Nick was saying, do we need more data collected? For instance, are those clients being referred for PrEP, and, is that the route that we need to go? Or do we need to ask that there be a task force to address? I mean, this is obviously a more global issue, that we have mental health issues impacting, or the home or the unhoused sector is intersecting with patients who have mental health issues, who also have IV drug use issues, and that's a county-wide, I guess, concern for local leaders especially as well as us, for public health. And I feel like we need to address that in some way.
I wonder if we have the data, and I'm going to ask Kathy, because I'm not an exorcist tonight. I can't turn around and look at her. And Lori, from what we get from Nick on a routine basis from what he says he collects, are we getting, like Lisa's question to him was, where are these people? Like, are we getting county residents of the folks in the syringes? Are we getting mental health, housing status, stuff like that? Thank you. Do we get that already? Or do we need to sit down with what we get and put together a list of what else we want? Like Nick said, he said he could add it in, because I think you're right, Lisa, more information helps inform us, right? So what do you guys know about this?
We are not allowed to ask for any identifiable information. We can't ask them, and
Okay.
they come in with the code. We talk to them, we find out their needs, and what we can tell what they get is when we do the referrals. And I can show you all the reports on that. I was going to, one of the things for the end report is to tally all the referrals to show you what we're talking about.
Mhm.
Housing is definitely a big one, so we know a lot of people are housing challenged or unhoused. As far as PrEP and B, right now we're doing HMP and HCV testing, and everybody gets a screening why they do it and get screened for prep eligibility. If they're eligible, they should be getting a prep referral.
Okay.
As far as the HSE risk factors, MS, and MSF with medical biggest risk here in Monroe County, but there are a number that are from IV drug use too. That's definitely the highest risk of mental effect.
And that's historically the way it's been in Indiana as well as really, except for New England. New England has a higher share of injection drug users.
Are we required to ask about citizenship this year?
Pardon me?
Are we required to ask about their citizenship as part of the governor's?
It's not first Indiana funds, is it?
Right.
But they believe we can't ask them. Yeah, I did want to say too, one of the reasons why we seem to give out more syringes than maybe some of the other counties is CDC's best practice is to ask them how many needles do you need until you can come back in order to get a clean syringe. And ours is the only syringe service program in the state that does that. The others do the 1-for-1 or a modified version for 1-for-1.
I'm also struck by the numbers though, because it works out to be about 1,000 syringes per customer per year, which is like 3 a day. And, that's a lot.
But am I wrong when I say, isn't it possible they are getting some extras for people that they're now a little too afraid to come to the program?
Exactly. We know this happens. We are not allowed, we don't ask about it. We understand it's probably happening, but we don't ask about it.
That would be my
We're not
guess.
supposed to do that. We have to record every exchange by zip code and number and what they bring back, what we give out, and by the zip code where it happens. So there's a legal requirements that we're supposed to report.
Does that help you, Lisa? Sure. Any other questions or discussions on this? Okay, thank you. Now Lori,
Okay. Yeah.
do we have anything in our packets that goes with what you think so?
No, it was in one of the previous.
I won't
ones.
look at it. I won't look for it then.
Yeah, so, previously I started looking into some potential recruitment, agencies, staffing agencies related to the nurse positions and the nurse manager position. So just wanted to circle back around to that. So there is an agency that can, work to find permanent placements for organizations. To see if that's something that we want to consider trying for at least, 1 or 2 of these positions. There's no fee until they actually find a candidate that we want to accept for a placement. At that time, for the nurse, it would be a $5,300 flat fee. So that comes within 90 days. So payment is due on the first day of employment for that person to the company. And then the candidate would be on our payroll and benefits like a county employee. If the candidate quits or is terminated within the first 3 months of employment, the agency will replace the candidate at no additional cost, so no additional fee. They keep a list on file of pre-screened credentialed candidates that they essentially will go through when they're working with an agency to try to find a good fit for a placement. So just thinking this might be something that we actually try and look into. I don't think it's not going to be any cost, again, unless we do move forward with a candidate, but it could give us an opportunity to let another agency kind of comb through candidates that they have that could be a good fit for a position here.
I think I would agree, since we don't have to pay up front, we pay once we get a person. But my question is, let's say we get a person, we pay them the $5,300. How confident are you that within the first 90 days, you're going to be able to identify any deficiencies that this person has and be able to terminate them
So
if needed?
I think that just having a really strict training first coming in, what's the required training that they have to get through within the time period? Are they able actually to get through that training that's going to be required?
for the job. And it would just have to, all of our employees, I guess, that we're hiring are kind of in that new phase of, evaluating their performance.
And what's the probationary period?
I think that it is within 3 months.
It's 3 months. I'm not sure.
And how does that work? I mean, I know that, will that raise any issues with HR and termination of someone within the first 3 months of,
That's kind of.
and what kind of documentation, all of that stuff, how does that work in with this kind of arrangement? And have we talked to legal about it, and as well as HR?
So I have talked with HR about, again, working with a recruiter, staffing agency, but not as far as the legality of if we were to terminate a candidate within an agency that was found.
I think we need to talk to legal before we go forward with this, because it sounds like it could be very dicey.
I think legal and HR need to give their blessing.
Yep.
And then if we do this, and if we do find a candidate, we do hire them, whoever the supervisor is going to have to be on it. And
Well, that's the problem. I'm the supervisor.
Well,
I'm
I know, but
trying to supervise.
I know, but we need another, I mean, you can't do,
I am the other supervisor, remember? I'm the other one up at the top of that org chart. And, both of us need to be assessing these people all the way through. And you can't see yourself as the only one doing this.
Well, no, but the concern is we need a person in that director role.
Exactly.
I can't keep.
I know, and we haven't wanted you to. So that's why we've been fighting for it for so long.
so I think it sounds like we're saying, yeah, it's a good idea. You may need to do a little more investigation before we jump into it, but I mean, it doesn't hurt to look at who they send, right? We don't lose
Right.
anything.
Yeah, I mean, you're only obligated if you actually want to then move forward.
Just out of curiosity, is that agency in Indiana or out of state?
I'd have to, I don't know, because they work nationwide, so I don't think that they're necessarily just an Indiana agency.
Do they publish the percent success of keeping the person where they go?
There's data that you can get from them for more information on that, like number of placements and.
Yeah, okay.
Because I would be worried that they've done a study of this to show that people aren't fired in the first 90 days. So they're willing to guarantee that 90
Yeah, but it's
days.
6 months.
Yeah.
Right.
And how many agencies have you actually looked at in terms of placement?
A lot of those months ago were for short-term.
Right, I know, but have we looked at any other full-time, particularly in terms of nursing agencies?
For permanent placement, you mean? This is one that I found, and I'm not sure if, no, not specifically. Yeah.
Isn't there a nursing shortage though still? I'm surprised nurses need to have an agency to find them a job. So it makes me concerned about the caliber of the nurses that need a staffing agency.
Find them a couple. Well, and despite the fact that I was told by Purdue Nursing and IU nursing schools that, they really only graduated in May, June, today it was like, no, there are also people who graduated in December. So I'm surprised that's what the nursing directors were telling me. And what we're doing, what I've suggested to Lori that she do as we interview a candidate and like them, asking them, who else do you know who is not satisfied with their particular position, inviting them to just reach out to other individuals and So I think that we still need someone in that managerial position because it's been way too much for Lori to do and to supervise the department.
Yeah.
And so, I guess my hope was that maybe one of these candidates for nurse position might rise to the surface like the cream and actually be the individual that we want, that can be the leader that we need, that could, instead of taking one of those simple nurse positions, simple public health nursing positions, would actually take the managerial position. So I'm still keeping my fingers crossed and hoping we find out from legal and HR that this sounds pretty kosher to them and makes sense.
This has little stars after it. Do you need us to vote on this?
Well, that would be if you wanted to vote to actually use this, if it was cleared by legal and HR.
What do you guys want to do?
Can we approve it pending input from HR? It would be better not to do it.
If you make a motion to do that.
Okay, then. I move that we approve that plan pending input from HR and legal.
I second.
All in favor? Any opposed? Oh, I forgot to ask for public comment on that. Is there any public comment from anyone online? Sorry, on just that one issue. Apologies. Okay. Yeah, I always forget. Unvote. Board of Health 2026 meeting schedule. I think it's in your packet. Looks like it's staying the third Thursday of the month at 4:30, if that is convenient with everyone's schedule still.
Well, when we went to every month, it was because we thought had all this money that was coming in and we didn't know what we were.
Yeah.
And I throw out the question, do we need it every month?
Or during COVID, we met.
Back,
We met
Couple
weekly.
times a
right, right,
Sometimes
Yeah.
possible.
right. But back in the
But-
day when I was first on it, I think it was quarterly something.
That's right.
When I-
Here.
Yeah,
Yeah, when I joined the board, I was told they met quarterly.
yeah. So I guess I'll ask Lori, can you get a crystal ball? And like the things that we need to vote on that are contracts that you can't take any action unless the board votes on. Do we need to meet monthly to do those items? Or do we want to go to an every other month or a quarterly schedule like we used to? Is that gonna make it impossible for you to do your work?
I think that we could do less meetings. If something urgent came up, you can always schedule a special session, like if you have to.
Sarah?
So I've been on other boards where indeed we have a schedule and we simply cancel meetings because there's nothing there. But at least you've set that aside and then it's a day off, or a few hours off, whatever. But if you don't have it, then you don't have something that you can actually go to and expect that people have indeed set aside the time. It's going to be more interesting for you unless suddenly 3 new board members fall out of the sky, to be able to do a whole lot of anything. And so I think you're better off having a calendar, and it's not my decision because I'm here one way or another.
And it's not my decision because I won't be here in
Exactly.
2026,
But
but I think as long as you guys make sure that you're not having meetings just to have meetings and you're having a meeting when you need to vote on something.
So I think my opinion is we should leave it as once a month, and then if we have to cancel it because we don't have anything on the agenda or nothing important, or then we cancel.
Okay.
I agree with that, especially considering we're transitioning everything in January. We don't know what we might need.
Would you want to make that as a motion?
Yeah, my motion is that we adopt the meeting schedule as monthly.
Thank you. Second,
I'll second it.
all in favor?
Aye.
Aye. Any opposed? Okay,
The other thing to look at is a quorum. Do we have a quorum?
Yeah.
And I'm gonna be gone during the month of January and February because we're heading south,
so
Can you be online?
but I will be online.
Okay.
Now, the last time we tried that, something happened in the department. We couldn't get online.
Well,
Or it
three of
was
our
with-
current
it was-
board members are, that are
Yeah.
here
so
tonight.
if you got
Maybe.
one,
Yeah,
two,
yeah.
3, 4 board members, a quorum is 3. Right?
No, quorum's four.
We have to have four.
You have to have all 4.
Yeah, but
Right of seven.
Yeah,
But
yeah,
each
yeah.
stadium-
Can I vote if I'm online?
We have to see your face. We have to-
Yeah, if your video, if your video, 'cause I did that.
Yeah, you- yeah.
Pull off.
Right, that's what I did.
I know.
It would just require that
You're
all
online.
this
I
be,
did-
I thought 4
I just pulled the apart.
yeah.
I think they've changed it, but we can double check.
We're gonna
but,
have to,
Maybe they
some of
changed
the
it.
This is when we're in a state of emergency versus when we're not.
we're gonna have to
So
ask.
things got more stringent with in-person once that was dropped.
Okay, okay, okay.
It used to be you couldn't vote online, period,
Mhm,
Yeah.
but you could
mhm.
participate.
Okay, so we're gonna have to get clarification on that.
Well, we've even seen at council meetings that as long as your face is there, that, and you are present, you can vote and you're considered to be part of the forum, at least at the county council level. So I would assume that it would play to your board as well.
So the next item is the election of officers, which is I talked to Steve about this. We came up with some suggestions we'd like to float, but especially for Mike, who's new, historically, the way we've done it is the whoever's the newest person becomes the vice president. And then the next year, that vice president becomes the president. So it would be Lisa becoming president. She indicated to me several months ago, she doesn't have time. When you're working full time, of course, it makes perfect sense.
And I've since actually, I have prepared myself because I knew everyone is leaving, so I'm willing to take on that work.
Oh, bless your heart. Okay.
Thank you.
And I would ask the, Kay and Mike and Steve, help Lisa. Help Lisa. Just pitch in. I know you all will. So how do we do this then? I don't remember.
Well, we're gonna have 3 new members. How quickly is the question?
I don't know.
But do we still need,
Special.
do we need a president and a vice president? Or are you saying we wait for the 3 new members?
No, we need to submit an updated roster to the state in January.
So we need a president. So we'll vote on Lisa. Does anybody else want to be president? Well, I do want to offer. Okay. She's running unopposed. So
Congratulations.
Well, most people do.
I know. So by convention, that would make Mike the vice president. Are you willing?
I don't know what it entails.
Not much.
But
When I was the vice president for Steve,
yeah, I mean, I'm happy to.
But you do have to step in for Lisa.
you have to step in for Lisa if she's unavailable.
But you can run a
yeah.
meeting.
Yeah,
If
I know how to
if
make
you're
meetings.
meeting, yeah, it's basically, or if something needs to be signed and she's out of the country, you probably sign it.
Yep.
Um,
I can do that.
probably not tough. Any other candidates for vice president? Okay, does somebody want
Congratulations.
to make a motion?
I would like to make a motion that, well, it seems like I'm appointing them, but I'd like to recommend that Lisa Robinson is president and Michael Teague as vice president for 2026.
Second.
All in favor?
Aye.
Aye. Any opposed? Congratulations. The last item, board and health officer comments, anything?
One brief comment, back in October, we recommended that we endorse a grant application from the urban forester for fixing up the ash trees in town, removing the dead ones and old ones, replanting those with new native plants. And it came through,
Yay.
$50,000, but it was a matching grant, so it's $100,000.
Oh,
So we'll have new healthy trees in town, which is a blessing for public health.
thanks, George.
Thank you for your leadership
Yeah.
on it, George.
His last meeting, he delivers.
That's right.
Yeah.
Good, no.
That's right.
I would like to wish everyone happy holidays, safe travels if you're traveling.
So by next meeting, hopefully you're 100% instead of 80.
Yeah, well,
Better than 85.
well, I'll be,
You should make him do some jumping
Whatever.
jacks when he gets in there or something.
And I'll be back the second week of March.
Safe travels. I hope you're going through. George, best of luck. We want to still hear from you somehow, although I won't.
You were our
George,
backbone.
either way.
as president temporary, as a temporary president.
I motion to adjourn.
Is there a second? All in favor?
Aye.
Aye.